Amalan ni jaijo yen iseseni TV East tomosawalo kore jaunjo tomo program wok le jena kape Airabetwok. Lebuni angini mukaga geon san wongon to pruiton sawan kanyape lo apara. Nano program alo yauni jo engaro non lego ikitijo otomai boy studio kerni jaijo kanoi no ngun le jasi toma Airabet. Datu purchuna ijai kede timu lebunit orionge taleja na kape Pilgrim Uganda, Pilgrim Africa, Louis Samaita kirono gelegela ane ko Uganda anawa mbombeti joni ariebo na emidi. Doto mo program lo alusilolongo ay nyala musuguntoma narai one of our guests mamu erai lo ejene inera atesot. So you will pardon me because once in a while I'll be chipping in English and then also atesot. This is Airabetwok, our parliament show here on TV East. And this morning, we are privileged to have Yeka Anthony Esenu, a member of Airabet Lego Ikiniti. Itunga lo olbuku kalo kapele biong. Osodi ijaibo kede ediope Dr. Yeka lejai enerkedoni akironi pu atupuruch kanalalo. Kutubere ngoke simala toni adoni alosta konye kedoke program. Honorable yalamango aijaunjo toma Airabetwok kimala sisinak.
Yalamanoi atekere April Pt1 enga kakiror erai Esenu Anthony arengo MP lo kapele biong. Yalama pukite so.
Ebo. Doctor, say hello to our viewers and then we continue with our program.
Hello, my name is Dr. Adoka Yeka. I'm a lecturer from Malaria University, School of Public Health, Department of Disease Control and Environmental Health. I also work with the Pilgrim Africa as a principal investigator on a number of studies that we have conducted, some of which were in the Katakwi district. Thank you.
Thank you, Doctor, and welcome to the program. And for you who is watching us from out there this week, you remember Uganda celebrated what we call the World Malaria Day. And the theme was getting back on track. Nenumnumera parana emidi. And before that, from Parliament on 23rd of this month, the members of Parliament and partners, including Pilgrim Uganda, took a walk in Kampala City to commemorate the day and raising awareness on malaria intervention in Uganda. And then in Katakwi district, Pilgrim Africa, Pilgrim Uganda joined us as TV East and Top Radio. Ainomunuma paraningin na aitun anoaike uneworo and memidi. And in that, there was away from the football match that most of you enjoyed, we also had the distribution of nets, treated mosquito nets. Neja siangoro muna justo madekis, nedoite, nedonto sidwelu didik, knowing that kopana otoma results lu idumunon aikeunu ariebona emidi. And I'm going to be reading to you some of the statistics and also that arose during the celebration of the World Malaria Day. And the average economic loss in Uganda as a result of malaria is over $500 million. You know what that means? And if you check this, in 2021, the World Health Organization reported that there were an estimate of 13 million malaria cases and over 19,600 estimated deaths in the country. And the average economic loss in Uganda due to malaria was, $500,000 million. That is only in that, in that period of time. That was between 2017, 2019, and the report was released in 2021. What does this mean for Uganda?
Okay. And I'm going to so that turn para pupu kerelu yaito mo TV.
Ebo.
Kai pupu noni automanti ashometa ara itomat studies no somati World Bank. Mi kamuto se sisia ATI lo twaniari Uganda wala PI. Kanu aitoji ariebo na emidi. Bakas kwe berai kidingi kapun imyulu America akwatakai 500,000 look mina akwatakai kepole be atu de betene billion itwa kana roni angoli karu anu ade kane midi kapun woni loste na soditi a medical examination ra nyine muron na yareti agwelike na iwuniete alo si tijanyo no re alo stona dekse da bongun na wongone ti marite qui ibote twanya tamato aswamu kon baka big like opportunity cost abo salo ste misiri kon ay kor ara alo sa chapar alo ste office isali jo alo sta mukian so imari kapun mun kere idumo no yebe baka be automaton alo dekasi angoli karu i milioni ni itomo na uni o Uganda dekasi midi akepole ba ngini paran itunga ilukumini akaisauni anu kanya peke da kwarata angini paran o Uganda dekasi midi do wangi tunga le twakete angini paran erai kopana itunga akaisa kanke duni angini paret iwutana 53 people die every day because of malaria. Just reported cases. Tungalu lui wadi katai automata dekis be mutana twana kokatwana dotwan za dekis. Kunyele twaketo chalo mamuni maritai. So dumu yebe alangiru na arieba ne midi. Eraine polo noi owala PI tomanto Uganda na yareti owaya lo adek halope. Omokberio angini paran 36,000 cases just adekesia. Kipunu be achepak adeparatu to bete na itunga. Le pote amota mukiana nginde kiso Uganda era no emidi. Ne jerso swami studies okata kui 2011 2012. Remember the first study we had in Katakui, okay? Keda also ay mukie tunga kede sikikali akere. Apotade kesia abukata kwi health center fo ogolokin almost nara mametelo adeka OPD apono golkinai olosi tomanti health centers kere no kata kwi amameta adeka so dum yebe alangir na area bane midi e polo noi e bade ne jay apugan ne ja adekis ne jasi e so makalo adekis ne jasi ne je economy e langir noi ise balarebe kai jar ko nenu munumu apak na World Malaria Day o Uganda kere oni kwa peteso ajana tebe erono ariebo ne midi de son tempere on kere ani nebe ipero ne aitananga ariebo na onyo okalia oko onyo oteso onyo Uganda.
Ebo. Thank you so much, Honorable, for raising that. I want to ask Doctor, you've been working with Pilgrim for a long time, and you're a doctor at the prestigious university in Africa, Makerere University. Why are you involved in Pilgrim Africa? Why did you choose to do this?
Yeah, thank you very much. As I've introduced myself before, I'm Dr. Yeka from Makerere University. I've been working with the Pilgrim Africa for quite some time. As somebody in the university, one of our key responsibilities is one, you teach the students. Two, you're supposed to be involved in research which informs policies, decisions which guide, especially here, health-related issues. And then thirdly, you're supposed to do community service. So Pilgrim Africa is so much concerned about the community. They're concerned about the welfare of the community. They're concerned about the health of the community. And they are involved in conducting research which informs policy to improve the health of the population. So I joined Pilgrim as a technical person to guide them to make sure that they are able to do very rigorous, scientifically sound studies which can guide policy formulations. There were important questions which needed to be answered, like Honorable talked about what they previously experimented. They gave drugs, they treated people, many people in the community, and the admissions in the wards almost were not there, the wards were empty. So we wanted to add the scientific rigor to look at this. Can we implement similar interventions in order to control malaria in the community? And can you be able to document these things and go through all the scientific rigor and see if such interventions really do work, and if they work, we'll accordingly advise policymakers about them, then the country can take the direction related. So that is how I got involved to work with the Pilgrim Africa, because we are all working together to promote the health of the people through research, through community work. So that angle of our work in academia made me to work together with the Pilgrim Africa.
Yes. So Pilgrim has been focusing basically in malaria intervention. Why malaria?
Yes, thank you very much. Malaria is, of course, one of the biggest health problems that we have here in Uganda, globally and also in Uganda. As you mentioned earlier, in Uganda we get about 13 million cases, which is a big number, and about 19,000 deaths every year. And these are just the reported ones. The unreported ones could go way above that.
Yeah.
We don't want any single death. Like the World Malaria Day message says, time to deliver 0 malaria cases is none. We want 0 malaria cases. So having 13 million cases, that's a big problem. 19,000 deaths, we have to reduce this to 0 so that we move to eliminate malaria, because malaria comes with lots of consequences for the people. When you are sick, there are so many other hidden consequences you don't realize. You don't go to work. You lose a lot of income. Children don't go to school. Above all, the disabled, the mentally. Mothers have abortions. Children who are born, they are born with low birth weights. Their brains are damaged. The child cannot even pass P7. The child cannot reason. The child cannot fend for himself or herself. These are big hidden costs. That's why the burden is so big. Something has to be done about it.
Ebo.
Yes.
Yala mano ijoin Esenu kang ni nere dokta ngesumun akironi kamera kede aiswa areba swam kere ngete loka Pilgrim Uganda owai kaloi midi. Nare jasa chekiro kere ni punu te beta swam konyo podcast rojo kasi swam na peta owai le TJ midi. Ngesaba kai bonbe. Araidu muje midi. Ipuati ukisono ija tartoma aberune pote proyedo ni kokwene dunwe munarake dama da chut enono kadam mamiko kepedora omo mejok ija si ati ukisoni kamera kide mental issues ijo ipote ijo lapyo ngunu kere, and then all of a sudden aloma berakoik and then baka be mentally poor. I mean, a person with a mental issue is a poor person. Just allow more.
Yes.
And then there is an issue that we've been trying to address in a very long time.
Yes.
How can we relate malaria to poverty? Because number one, as the statistics show here,
yes,
Uganda loses about $500 million in a year.
Correct.
So that means in every person who goes to treat Al-Mukane malaria in a month,
yes,
if you're 5 people in a household and 3 people fall sick of malaria in 1 quarter,
yes,
that means you're spending lukuminto mnakany Al-Mukane 1 person.
Exactly.
And then you're 3 people. And then you're living under $1 per day. So how do we relate? Is malaria one of the causes of ichanlui hata si oteso kede Uganda kere?
In fact, yalama noi narai autango to connect borkonguni yare. Ate kere adde kana imidi erai adde kana aluichan. That's the most unfortunate thing, that malaria is a disease of the poor.
Okay.
Now, akwap kere world all over. The moment economic status of a society improves, malaria goes down. Kopano, for example, you find Kampala as a city. We are the most affluent part of Uganda. We have the least cases of malaria. But you go to my village, go to the poorer parts of Uganda, you go to Kataku, you go to Kapelebion, go to Karamoja, go to, West Nile. People are living in small huts. Malaria is endemic. Go to all those areas. So we find that the connection between malaria and poverty is so highly correlated. And as an organization, we felt that if you wanted, Pilgrim initially began its operations dealing with socio-economic problems of Teso. Education was one of them, agriculture, response to relief programs, and then we tackled the issue of livelihood and economic empowerment. And we realized very, very quickly that poverty and malaria were going hand in hand. And people were spending most of their energy and time either treating or taking care of patients of malaria. So we decided to say, let us focus on this question of malaria. And so we, as an organization, and a Pilgrim, began to evolve into a malaria-focused kind of organization. Now, again, the question of poverty. Why is malaria a disease of the poor? Number one is, first of all, the kind of houses the poor sleep in. Okay? Houses which have got mud and water are very good hiding ground for mosquitoes. Houses which have got plaster and walls and so forth do not provide a safe haven for mosquitoes to hide and rest in. Number two, they don't have enough lighting. Now, you go to the villages, people sleep at around 6 or 7 o'clock, they go into a dark room. They have all the time to feed on people. But in town, a person has got a permanent house, has got lighting in the house. So this electricity in itself, it scares and kicks out what? Scares out mosquitoes. Number three, when it comes to access to mosquito nets, the rich can afford to buy for every child in the house or everybody a net. But the poor people can't. So they have to wait for government programs to give them nets. And those nets are limited in number. You go to point number 4. Whenever there is a case of malaria, the rich can quickly respond and go to get treatment, go and see a doctor, and the case is controlled and taken care of immediately. But the poor don't. They just go and buy Panadol and take on Panadol, while the mosquitoes are able to distribute that infection to everybody in the house. By the time they realize everybody in the house is sick, and this cycle goes on and on and on and on. So poverty and malaria go hand in hand. And we believe that if Uganda, if atesot, if households can control and bring malaria cases to 0, they will have relieved themselves in terms of financial burdens, but also the time to focus on economic activities will be available. So poverty and malaria are bed partners. They go hand in hand.
Yes.
And once we kick out malaria, we are very confident that atesot and Uganda will be on its step to getting out of poverty.
Yes. Ebo. So ngesungun ijo yani pupo kingangina da Honorable Esenu Ekeonungun. Doctor, as we go for a commercial break, I want you a researcher at Pilgrim.
Yes.
And then you've been doing this, as in my understanding, since 2012, around there. Now, why does Uganda have such a high burden of malaria, apart from the basics that Honorable was given? What did you find out in your research?
Yes, thank you very much. That's a very good question. One may wonder, why is malaria so big an issue in Uganda and the other neighboring countries, and less of any issue in the other areas? There are so many factors which are responsible for the occurrence of malaria, some of which are natural, some of which are man-made. Among the key determinants of malaria is climate. And the key climatic factors that determine the occurrence of malaria is rainfall, temperature, and humidity. And the climate in our area is very perfect for malaria. For the mosquitoes to breed, for the parasites to develop in the mosquitoes, it is very ideal.
How?
First of all, mosquitoes lay their eggs in water. That's how they multiply. So we need rainfall such that there are pools of water everywhere where the mosquitoes breed. And we have adequate rainfall in all environments. We have swamps and so on where mosquitoes breed. And the temperature. You know, the parasites, once they are in the mosquito, they can develop under any optimal temperature range. The lowest is 15. The highest is up to 30. And our temperature range is around there. If temperature is lower than 15, the parasites don't develop in the mosquitoes. Mosquitoes are there, but they'll have no parasites. That's why in the cold areas in Europe and other, the mosquitoes are there, but the parasites are not there in the mosquitoes. And you got the deserts, temperatures are so high, there may be no water body, and again, parasites can't develop in the mosquitoes when temperatures are high. So climate is adequate. Other factors are related with the agents. We have the mosquito vectors, which are efficient transmitters of malaria. We have them in the environment. The female Anopheles mosquito, Anopheles esgambiae, Anopheles fenestas, Anopheles arabiensis, very efficient in transmitting malaria. We have them in our area.
Yes.
Coupled with that, there's resistance, insecticide resistance developed by the mosquito, so that even if we spray sometimes, it may not have impact.
Okay.
These are a couple of issues. Also, we have the most efficient parasite, which causes severe disease in the environment. That is Plasmodium falciparum. In about 98% of malaria cases in Uganda.
Okay.
Other factors are human-related factors, related to human behavior.
So, Doctor,
sometimes we create grounds for the mosquitoes and so on. So we have a perfect environment for malaria to exist.
Doctor, I would like us to take a break, but I need you to give us more insights on the human factors that are leading to the high burden of malaria.
Which we can easily control.
Yes, so enjoy Esenu kingang na iroko jeto my Airabetwok. Jai tatam akiron kamar kida dekangin na itapasi tungakere angini paran tupuruch parne bong los yoreje ebaka bedeka muta ne baka binyo obino akuta bya ne malaria ebaka binyo be koto lukumina kaisa kwana do lukumina kaisa kanyape for you to heal from malaria. So mungesi jai lo laita tam sir kunyaka wene kon television ibongu ni akalo na yango